we're going to go over your medications
Okay.
today because I want to make sure that you're confident and comfortable as you go and give medications with your patients.
Okay.
So let's start doing that.
Okay.
Tell me about,
Kim.
yeah.
Hi. My nurse just said I could go to dialysis today, and I wanted to come to you and see if that was okay.
Oh, yeah, I think that's going to be great. Can I just finish doing this? And what I want you to do, the patient's not leaving for a little bit.
Right.
Okay, so why don't you go and look up a little bit about dialysis, because that's a new concept
Okay.
for you. Look it up, and we're going to have a conversation and make sure it meets some of your learning objectives.
Okay,
All right?
sure.
Give me 5 minutes.
Okay, my first medication is cold.
Hey, Megan.
Hi.
How are you doing?
I'm good. I'm excited about dialysis.
Yeah, this is a great opportunity. It really, I knew that your patient had renal failure, but I didn't know today he was going to dialysis.
Yeah, I didn't either.
So that's good. And this actually, we're going to be talking about this in a couple weeks.
Okay, perfect
So,
timing.
yeah, so I'd really like you to, go in and listen and ask some good questions, but I want you to be prepared before you go in. I don't want you to just go in and just kind of be a blank slate.
Okay.
So one of the things I want you to look at is the role of the nurse.
Okay.
How important that is. I mean, don't just focus on necessarily the patient, but see what the nurse is doing, and in terms of when the nurse gets vital signs, and when the nurse gives meds, and how the nurse does things.
Okay.
I've called the dialysis unit, and they said it's perfectly fine for you to come
Okay.
and be with your patient. So
Great.
I think that'll be good. So what would you like to get out of that? What kind of objectives do you think that you have for the experience?
Well, I haven't been on a dialysis unit before, and I imagine that the role of the nurse is a little bit different than what we've been seeing on the floor so far, but since I haven't been there, I don't quite understand what that's going to look like. So I'm excited to talk to the nurses and see what their day is like and how they take care of their patients. And also what the patient's experience is. I know they're coming and going, and it's something that's pretty routine for them, but it's new for me to see, so that'll be good to learn from.
And remember, your patient gets dialysis at home. So we're just continuing his care. So when you develop your care plan, think about that. And think about, is this part of his, his makeup? This is part of his history. Is that really an acute thing or not? Are we dealing with, and then also think about, is the patient stable during this procedure? Well, the principles of dialysis, as you looked up in your book, is in order to have hemodialysis, the patient should be somewhat stable. So think about how we're monitoring for that as well. The other key things with dialysis is, we talked about vital signs, the labs. So we haven't talked yet about renal in class yet, but we will in a couple weeks. So just some of the things we think about. The renal system, the BUN and the creatinine, and we're looking at that.
Okay.
Also the anemia issues. So think about that in terms of your care plan. The patients generally have low hematocrit and hemoglobin counts. So I want you to take a look at those labs.
Okay.
What else could you look at? Look at the medications. It looks like your patient's meds were held this morning because we didn't give meds.
Right.
So why don't you think about questions to ask around that, and why were the meds held? If you think about the patients going to dialysis to clean their blood,
Sure.
what would that do to the medications if we gave them
Take them out,
before?
yeah.
Right. So thinking about that, I also want you to pay attention to the access that they're using and figure out what kind of access that the patient has for the dialysis treatment. And just soak in as much as you can, but definitely go in, thinking about your objectives before you go in. I really think that this is going to hit some of your learning outcomes for this course. When you get done, I would like you to talk about that in post-conference.
Okay.
So think about that while you're there, and what are some of the things that you might want to share with your colleagues about it, because everybody's going to get this opportunity.
Okay.
So, and as it comes up in class, this is going to be invaluable information.
Great.
So I think that you have everything you need to go for this observation. I think it's going to be great. Remember, you have your checklist and be ready to present in post-conference. I think it's going to be great. I'm excited that you get to do this.
Yeah, I'm looking forward to it. I can't wait to come back and tell you what I saw.
Yeah, I think it's going to be great.